The orthodontic airway plate, known as an OAP, is a unique treatment for Pierre Robin Sequence. As you can see in this first picture, the tongue is collapsing in the back of the throat, blocking the child's airway. You can also see that the lower jaw is quite small and recessed. So the OAP, you can see on the right in this picture, is custom fitted for the child, and it's placed in the upper gums, and there is an extension that goes down the back to push the tongue forward out of the airway.
OAP is a unique functional treatment for Pierre Robin. Not only does it move the tongue out of the way, opening the airway, but it also stimulates the lower jaw to grow.
It does take the infant a couple of days to get used to this device, and it also takes the parents a couple of days to get used to placing the device in and out and cleaning it. So in this video, I will demonstrate our use of the OAP and how we cleaned the OAP, how we placed it, and how we removed it. The second picture you can see is the OAP device for my son, and these are custom made for each child, so they will all look a little bit differently, but this is how they look. You can see the extension there, and then the upper plate for the gums, and then these little wires are used for tape to kind of help secure the OAP on the outside of the child. In this video, you will see us removing the OAP device, and anytime you're undoing the rubber bands, you do want to secure the adhesive and the steri strips to the infant's forehead before you undo the rubber bands. And then you can see that you gently kind of just pull down on the device and the OAP comes out. You do want to avoid tugging on the little metal pieces, as those can bend and move. So you do want to put your thumb more in the middle when you take the device out. And then you're going to use the gauze to clean out the adhesive glue that is on the upper gums of the child. And then you're also going to wet the gauze with non-alcoholic mouthwash and clean the gums to make sure that you removed all of the adhesive. And we did this outside just so that there was better lighting, but you can really do this anywhere where your child is comfortable and where you are comfortable. You do want to make sure that you have everything ready before you do this. So kind of go through a checklist, make sure you have your gauze to clean, the adhesive, your non-alcoholic mouthwash, your steri strips and tapes all ready to go before you do video. You'll see us cleaning the OAP. So every time after you remove the OAP, after you're done cleaning your child's gums, making sure that all that adhesive is out of their mouth, you want to clean the OAP device.
To clean the OAP, simply use water and a toothbrush, making sure to remove all of the adhesive. To dry the OAP, use gauze. Make sure that you wash your hands prior to putting them inside your infant's mouth or touching anything that goes inside your infant's mouth.
Placement of the steri strips is done initially and then as needed. We found that we needed to replace the steri strips about once a week. You know that you need to replace them if they're becoming loose or if they fall off. In this next video, you will see that we are placing the steri strips. You do this actually before you put any adhesive into the OAP. And the point of this is to make sure that you have the tightness of the steri strips correct. The purpose of the steri strips is as a backup to hold the OAP in place if the adhesive fails. This is important because the OAP does have that tail that goes down into the infant's throat. And if this was dislodged, it could obstruct the airway or be uncomfortable for the infant. So you have to basically have your steri strips ready, and your doctor will show you how to do this. It's very simple. You just put the steri strip through these little rubber bands, the little orthodontic rubber bands, and then tape it on one side. And you put the OAP in place, then you put the steri strips on, and then you check that the OAP is secure. If the OAP is secure with the steri strips in place, then you know that the tightness level of the steri strips is correct. We found that putting the steri strips a little tighter than we thought was necessary seemed to work a little bit better than putting them on more loosely. After your OAP is well cleaned and dried, then you want to apply the denture adhesive, and your doctor will tell you exactly where to put the adhesive. And the placement of the adhesive may slightly change as the child grows and as the device is kind of adjusted for the infant's mouth. So in this video, you can see how we are carefully placing the adhesive as our doctor had instructed us to do. It does sometimes take a little bit of practice to get the right amount of glue. You want to make sure that the device stays in place, but you also don't want to have so much glue that it's extremely difficult to take the device out or to clean the gums. The adhesive is a denture adhesive. We found that the Polygrip super strong hold seemed to work the best for us. So once you have your steri strips in place, you've checked the position of the steri strips, you have your OAP cleaned, dried, you have the adhesive in place. Now you are ready to put the OAP back into your child's mouth. So before you do this, you want to dry the infant's upper gums. This just helps the OAP adhere to the gums with the adhesive better.
You want to position yourself at the infant's head with good light.
Position your child so that you are comfortable, the child is comfortable, and the OAP with practice really just slips in place. You want to make sure that the tail end of the OAP is on top of the tongue. You put it in the back of the infant's throat, and with a slight kind of downward pressure and then upward pressure, the device slips in. Initially, this is somewhat uncomfortable for parents to do, but you will get used to this. Also, initially, the infant will cry. They're not used to this as well. It's slightly uncomfortable. It does not hurt them, but it's not comfortable initially. And after several weeks, the child gets used to this and they don't even cry. At one point, we were able to change the OAP with my son asleep and he did not even wake up. So don't be discouraged at first. It might seem slightly difficult, but with practice, you and the infant will get used to this and it is not uncomfortable for them. My child was very happy with the device in place. And once they're used to it, they're actually happier because they can breathe and then they start to learn to eat. You have the OAP in, you put a finger on the steri strips to make sure that they don't move. And then you also have your thumb to put pressure on the OAP up into the gums to make sure that it stays in place. You hook the little rubber bands and then you maintain pressure on the OAP upwards into the gums to help the adhesive adhere. And your provider, your doctor will tell you how long you need to do this. It should be at least 30 seconds to a couple of minutes. Our son, we found we were able to hold the OAP for just a little while and he did not scream and the OAP stayed in place. And this is how you remove the OAP, clean it, replace it, tape it. It really is very simple after you get used to it and it is a wonderful device. This last picture, you will see a before and after of our son, and then you can see him in the last picture. He is almost 2 years old and thriving, eating, breathing, sleeping, doing very well.
Keep your chin up, my baby. Everything is gonna be okay now. Keep your chin up, my little one, my little one. Tomorrow's a brand new day. Keep your chin up, my baby. Dry your tears, it's gonna be okay now. Keep your chin up, my little one, my little one. Mama is right here with you. Keep your chin up, my baby. Smile in the rain. Keep your chin up, mommy, mama. You'll get through the pain. Keep your chin up, my baby. Keep it sky.